Hi, my name is Kirsten. I'm going to be your nurse today. Are you Kendra?
Yes,
All right. What's your date of birth?
12/31/66.
Okay, perfect. So what we're going to do today is just get you all cleaned up. We're going to switch you over to your bed and to the chair, okay? Do you have any questions for me?
Not right now.
All right. Did you need to use the bathroom?
Yes, I do.
Okay, perfect. Let me go grab the bedpan. I'll be right back for you. As I leave, I'm going to make sure the bed is in low position and the side rails are up. I'm going to leave, pull the curtain. I'm going to go wash my hands and go gather my supplies. When I come back, I'm going to have the bedpan. I'm going to put my gloves on. Alright, so what I'm going to have you do is reach onto that side rail. I'm going to turn it over. Alright, I'm going to put the bedpan into the mattress. Alright, you're all set to roll back over towards me. Perfect. Alright, is that comfortable?
Yes.
Alright, so what I'm going to do is raise the bed. Perfect. Alright, and then make sure you have your call light right next to you and then your toilet tissue. When you're done, just let me know and I'll come right back in for you, okay?
Okay.
Alright, behind the curtain, I'm going to go wash my hands. Alright, are you all set?
All set.
Okay, perfect. So I'm going to apply my gloves. Alright, so with my gloves on, I'm going to lower the bed. Alright, I'm going to have you turn to that side rail for me. I'm going to be holding the bedpan as she turns so that it prevents splashing. Alright, and then if I see any excess urine or stool, I'm going to wipe that off of her. Making sure the pad is not soiled at all. Make sure she's all dry down there. Alright, you can go ahead and turn back over for me. Perfect. And if my hands are soiled, I'm going to go wash them, making sure that the bed is down in the down position with the side rail up. And I'm going to come back and change my gloves. Coming back with the bath sheet. So I'm going to put the bath sheet over her. Go ahead and hold that top for me. I'm going to pull this down. Pulling it away from me, and this will go into a linen bag to be clean. Alright, so I'm going to put the bed at a working height with the side rail down, and I'm going to place the bed up. Perfect. Alright, so now that her bed is at an incline, I'm going to start her oral care. Alright, so with my hands washed and my gloves on, I'm going to start brushing her teeth. I'm going to place the towel below her. So if she had dentures, I would make sure that I place them into the bin with the tablet so that they're clean. And I would brush those in the bathroom, brushing the top and bottom, and making sure that I also brush her gums and her tongue and her cheeks. And if she was able to brush her own teeth, I would allow her to brush her own teeth. But she's not able to, so I'm going to brush her top teeth, her bottom teeth, her tongue, her cheeks, and her gums, allowing her to spit and rinse. And if my patient was comatose, I would make sure that their head is leaned to the left, allowing the saliva to gather on the left side. Also providing suction, so there's no chance of aspiration. And I would make sure that I would take the sponge, making sure I get their teeth, gums, and tongue. And then after this, so I'm going to brush your teeth. Can you rinse for me? Perfect. Go ahead and spit for me. Perfect. Alright, have her mouth dry. And then if my patient was male and he needed to be shaved, we would look at the hospital protocol. And then she's female, so we're going to do her hair for her. So if she had long hair, I would start at the bottom, working my way up to the top. I could put it in a bun or however she wanted it, in a braid. Alright, so now that oral and hair care is done, we're going to wash her face. So I'm going to go get some more water. I'm going to put the bed in low position, making sure side rails are up. Alright, so I'll go get my supplies. Alright, so now that we're back, I'm going to put the bed into a working height position, making sure she's at an incline for me. Making sure I get her face. We don't use soap on the face, so we're just going to use the warm water that we got, starting from inside, from her eyes, working our way out, using different aspects of the washcloth. Alright, pat her dry. And I do have my gloves on with the towel. We're going to put the bed in low position, making sure it's at a good working height for me. We're going to start with her arms. Put the towel underneath her arms. So with warm soap and water, I have my gloves on. We're going to start with the soap, and we're going to make sure we're going from proximal to distal, getting her whole arm, making sure we're getting her hands, making sure we're getting her armpit. Alright, and then new washcloth, we're going to rinse her arm, armpit, and hands. Alright, and then we're going to pat her dry. And then if I needed to go warm the water again, I would do so, and I would lower the bed, putting the side rails up. Patient safety first. So next, cover her arm. Next, I would do her chest. I would lay the towel beneath her. With a new washcloth, we use new washcloths with every extremity. So for a female, we would lift the breast tissue up with the back of our hand, making sure we're getting under everything with soap and warm water. And then we would rinse everything, making sure we pat dry with the towel. And then next, we would move on to the stomach, making sure that we use soap and water. And then we would rinse and then also pat dry with the stomach. Alright. So now we're done with the upper half. So I would go and change the water, putting the bed in low position, side rails up, go change the water, come back, reapply my gloves. Next we're going to do her legs. Alright, I'm going to have you lift your leg for me. Put the towel under her leg with my gloves on. I'm going to start proximal to distal, making sure that we get the hamstring area going all the way to the feet with the soap. Then we would rinse. Alright, and then we would pat dry, doing this on both sides of the body. And then next we would, I'll take the towel from beneath you. Next we would go change the water for peri-care. We would lower the bed, put the both side rails up. Then I would come in, put my gloves on with my hands washed, and I put the bed back into working position for me. And then for peri-care for females, we would start at the inner thighs, working our way in, making sure that we're always wiping from front to back, making sure we're getting all folds, making sure that always front to back, outward to inward, and then making sure that we use soap and we rinse, and then we always pat dry. And then for males, we're going to make sure that we pull down the skin, making sure we clean the whole penis with different aspects of the washcloth, working our way down to the scrotal area, making sure we get the inner thighs, making sure that we have all of our soap rinsed off, and drying thoroughly. Alright, so now we're just going to get your back for you. Alright, so I would go change the water, making sure that the bed is in low position and side rails are up. Go change the water, go get warm water. Alright, so now I'm going to turn you onto your side. I'm going to have you reach for the side rail. Perfect. Alright, so exposing her back with the warm water with my gloves on. We would wash her back, and this would be a good time for skin assessment, looking for anything that looks abnormal. Alright, so we would wash her back with the new warm water, changing our washcloths, and then rinsing, and then having this towel down here to catch any water. So we would rinse. Alright, and then did you want a back rub?
Yes.
Alright, so for a back rub, we would just change our gloves and then working our way from bottom to top all the way to the shoulders. Alright, and then we always tell the patient what we're doing when we're going down here. So if I needed to change the water, again, I would lower the bed, pick the side rails up, go get new warm water, a new washcloth, change my gloves, start from outward to inward, catching any excess stool that I didn't get or anything like that. Alright, and then we would pat dry. And then since she's already on her side, we can change the bed. So this would go into the linen bag. Alright. So we are going to roll, making sure the bed is a working height for me right now. I'm going to roll the soiled sheets towards her, and then we're going to grab the new, making sure nothing is touching the ground. Tucking the clean under the dirty. And we don't want any wrinkles. Alright, and this is my draw sheet. This is my new pad. Alright, very nice. Alright, so now that the new sheets are on, I'm just going to change your pillowcase, okay?
Okay.
This will go into the soiled linen bag. Alright, and go ahead and lift your head for me. I got your shoulders. Perfect. Alright. So what I'm going to have you do, I'm going to lift this side rail up. You can go ahead and turn towards me. Perfect. Alright, and then I'm going to put a new gown onto you. Go ahead and Alright, I'm going to pull this blanket off. That will go into the linen bag. Put a new blanket on. Making sure she's covered. We would make the other side of the bed. But as of right now, we're just going to make the mitered corner. Go up. Making sure she has toe room. Alright, so are you comfortable?
Yes.
Alright, perfect. So next we're just going to get you up into the chair, okay? Alright, so I'm going to pull these down. So at this point, I would make sure that if she has any stockings, that we would put them on. We're going to make sure that the wheelchair is in working position and it's locked, and that the bed is at a good position for her to stand and that it's locked so that her feet aren't dangling or she doesn't have to jump off. So the bed is at a good height, so what I'm going to do is have you turn over towards me a little bit, and I'm going to reach behind your shoulder and your legs. I'm just going to sweep you over, okay?
Okay.
Alright, ready? Perfect. Okay, do you feel lightheaded at all?
No.
No? Okay. Alright, so I'm going to put a gate valve on you, and we're just going to, on the count of 3, we're going to pivot. We're going to sit you down this way, okay?
Mm-hmm.
Alright, so the gate valve is on, so on the count of 3, we're going to rock back and forth, and we're going to pivot, okay? Ready? 1, 2, 3. Alright. Go ahead and sit for me. Alright. And at this point, I would make sure that she has her cull light available. Make sure she's all settled and has everything accessible to her, making sure the wheelchair is locked. If she has any questions for me, I would answer them. Making sure the bed has no wrinkles in it as she got up. Alright, if you have any questions, just let me know. I'll be right back. Alright, so my hands are washed. We're going to get you back into bed, okay?
Okay.
Alright, so I'm going to apply the gait belt again. And then on the count of 3, we're going to stand up, okay?
Mhm.
You're not feeling any lightheaded right now?
No.
Are you ready? 1, 2, 3. 2. Alright, you can go ahead and sit. Perfect. Alright, so I'm going to help you with your legs into bed, okay? Are you ready? Alright. Perfect. So we're gonna, do you want to lay face up?
Yes.
Alright. So we're gonna put her into a supine position. So we're gonna put this pillow under her knees. Perfect. Alright, and then next we're gonna put this pillow under her. Perfect. And then we would raise the bed a little bit, incline the head of the bed. Next we would put the side rails up, making sure the bed is in low position. And yeah. Have your call light right here for you. Do you need anything else?
No.
Alright, so I'll be here all day. If you need anything, just let me know, okay?
Okay, thank you.
Alright, I'm gonna pull the curtain and then go wash my hands.